Let's have a great show. First off, we're going to talk healthcare. Now, people talk about wait lists to get an MRI or to see a specialist. We talk about access to primary care. But one facet of healthcare is also the number of missed or skipped appointments. Josh Taylor's with the TxtSquad. He's the founder and CEO. We'll talk about exactly that right after this. Don't go away. Welcome back. When I say missed appointments, sometimes I think people hear me saying that I'm blaming it on the individual. Well, some of the onus is on the individual, but some of the onus is also obviously on the system. Just to use the quote from then Minister of Health and Community Services, Tom Osborne, this back in 2023. The monetary cost for missed appointments is in the tens of millions of dollars. It's difficult to measure, but it's probably a couple of $100 million. Join us on line number 2 is Josh Taylor, the CEO and founder of TxtSquad. Good morning, Josh. You're on the air.
Hey, Paddy. Thanks for having me.
Happy to have you on. Look, this is an important part of the conversation that kind of gets left by the wayside. So what exactly is TxtSquad?
So we're a St. John's technology company, so we're a startup. We've been around for about 6 years. But really, we're a patient engagement platform. So at the core, it's as simple as this. It's just a two-way texting with AI. So if people, wonder what that is, it's literally just texting back and forth with the doctor's office. Now, the system does more than that, but at its heart, that's kind of the core of just making patient engagement very simple by using texting at its core.
And so is this all input insofar as the algorithm is concerned with information directly from the doctor? Because we do know that there can be problems if you talk about like garbage in results in garbage out. So bad information in the algorithm produces bad info. So how does it start at the doctor's office?
Oh, yeah, that's a great question. So there's a lot of different uses for our system, but the primary one is to remind people that an appointment is coming up, to make it easy for them to communicate if there are challenges. Because, you mentioned people forget about appointments. That does happen. Maybe the letter doesn't arrive, or you missed a phone call, or maybe you never got one. But also life happens, right? You get stuck in traffic, your child's sick, and if you can't get in touch with your doctor's office in real time, then there's no way to reschedule and that resource is lost. So that's kind of the core, but we do a lot more than that. We're a multilingual platform, so we support new Canadians, as well as we're a medium through which patients can rate and give quality feedback on their service. But we're also into more complex use cases, like in bariatric surgery. We did a project to allow surgeons to communicate directly with patients post-surgery to make sure that, the symptoms they were seeing were what would normally be expected, which would keep them out of, say, the emergency room and get infection. So there's a lot of different ways. But I should say when I mean AI, I'm talking about saving and summarizing for reports, not making medical decisions. We're there to help people in the healthcare system, to make them superheroes. We're not there to take over any medical advice. For sure.
And you could have gotten an appointment that the wait time was a year. And as you say, life happens. That can just fall out of your mind. Maybe your symptoms have waned, like whatever the case may be. So missed appointments, to quote Minister Osborne, costs us untold tens of millions of dollars per year. Okay. So you've been operating in Ontario, as far as I understand. What has success looked like? Give us a benchmark of how many appointments were being missed versus the application using TxtSquad and the reduction of missed appointments.
Actually, our primary, we started in Newfoundland, actually, Paddy, with a pilot project in 2023. And so the Newfoundland Health Innovation Team have been fantastic, and they helped us shape this opportunity. So we deployed last year in the family care teams, 2 in St. John's, Holyrood, and Bay St. George. And as well, we deployed in the new Canadian clinic, as well as walk-in clinics and endovascular and bariatric surgery, as I just mentioned, among a few other use cases. Through that, we saw significant reductions in no-shows. In clinics that had really low no-show rates, like at Bay St. George, where they put a lot of energy into calling patients, they were able to no longer call them and still maintain that success. But other clinics where they had 10, 12, 14% challenges with basically no-shows or lost appointments, we were able to reduce that in some cases 30, 50, and 80%. So it really depends on the patient demographic and how acute the problem is, but we're able to see 50 to 80% reduction. And we see that outside of Newfoundland as well. As you mentioned, we're in Ontario, we're across Canada now in private clinics. And kind of our big push right now is to replicate the success that we've had with Newfoundland Health Services with Ontario Health.
So obviously what you just said there makes it certainly beneficial to the clinic as well, because my initial thought was great for patients, to have that helpful reminder, the two-way texting, make sure that I'm always in the loop as to what's going on. But for the clinic, the time spent trying to remind patients that they have an upcoming appointment is time that could be better spent doing anything else.
Absolutely. And actually, the data proves that. We had 87% satisfaction rate among the staff in the pilot process. 83 and up of patients both enjoyed texting and thought it was very easy and loved it. But here's the thing, Paddy. Texting is great, but what it also does is it drives down phone calls overall, so it frees up the phone for those people who are not able to text. And they want to call in, now they can get through. So a lot of people just liked it. It's so simple, but just being able to get in touch with your doctor. And of course, that medium, texting, works so well because it's the app that everyone has on their phone that they're always logged into. These health apps where you got another login in another place and it's on your computer or it's on your home. It creates a lot of barrier to engagement, so it's not a real good place to communicate.
So you talk about it having rolled out as a pilot here. If we're reducing no-shows, consequently saving money, consequently freeing up staff to do other more important things, where's the next steps or next stages with this government?
Absolutely. So the pilot project ended last year, and then we kept it going until we did a Eastern and Western procurement for the family care teams. That started in April, and since then we've rolled out to Port-aux-Basques. And in the next few weeks, we're rolling out to Corner Brook and Humber Valley, so that'll come in the start of October. As well, we filled in the rest of the family care teams in the St. John's area. In terms of a broader procurement, we're working with NLHS to make that happen, and we're hopeful that we can get this out because it's not a year-long project. It's nothing. It's already through the privacy. Everything's ready to go. If a clinic deploys our system, it's really from the time they first email us and we schedule a trip, it's less than 2 weeks, and they're live, and they're immediately getting those impacts.
Let's talk about cost-benefit analysis, which would be part of your role and, of course, also for the government. So if we're talking about the potential for savings, how much does your service cost? And I don't even know how you charge. Is it on per clinic, per patient? I'm not sure how that works, but give us some sort of sense of cost-benefit.
Yeah, well, during the pilot project, and of course, you can always cherry pick data, Paddy. You can pick really bad clinics or really good clinics a little bit, but we saw a 12x ROI on our system. So 12x just on no-show appointments. So independent of improved patient navigation, independent of better health data, independent of staff satisfaction, we saw 12x just on ROI just from no-shows. So the value is there. Our system is a software system. It's not incredibly expensive, and the value it provides is immediate.
Anything else you'd like to add, Josh, while we have you?
Oh, nothing. Just that I'd say that NLHS has been a fantastic partner and very helpful, as have NRC and the Genesis Group. And St. John's is a great place to start a tech company. And we've seen fantastic traction as we've moved across. So we've got 3 pilot projects starting in Ontario, as well as we've already gone live at a few of their community health clinics, which are like a not-for-profit equivalent of our family care teams. And we're seeing the same results. And to be honest, Paddy, we do have a couple of projects and a lot of individual small clients in the U.S., but the Buy Canadian component of this has been very, very positive throughout the rest of Canada. We're getting a lot of support for Newfoundland health innovation. And, if I could make a plug for Bounce Health, I feel like, Paddy, that health innovation, digital health specifically, could be a strength for Newfoundland and Labrador. We have quite a few good startup companies in this space, and I'm glad to see NLHS support us and support local procurement, and I hope we can grow the sector.
I appreciate your time, Josh. Good luck.
Thanks so much, Paddy. Appreciate it as always.
My pleasure. Bye-bye.
Take care. Bye.
Josh Taylor with TxtSquad. He's founder and CEO. Look, if it works for the patient, it works for the clinic, because sometimes the tech is right there in front of us. And he makes a nice point that not everybody is in the world of texting. I am, but not everybody is. So if that frees up a phone line for someone who does not use their smartphone or does not text or does not want to use that type of application, maybe streamlines it. Let's take a break. When we come back, we're speaking with you. Don't go away.